Blood in urine, a silent warning sign of bladder cancer. Many people ignore. There's one health sign that may seem minor, but it could be a direct signal that your life is in danger, especially for people over the age of 60. That sign is blood in your urine. You might have noticed your urine looking slightly pinkish, darker than usual, or streaked with a light red tint. And then it disappeared. So you thought, maybe I ate beets. Could just be dehydration. It'll pass in a few days, but here's what you might not know. Bladder cancer, one of the most dangerous and recurring cancers in older adults, often starts with just one symptom: blood in the urine. Even more frightening, according to the World Health Organization, up to 80% of people with bladder cancer experience no pain or other symptoms, just blood in the urine. And by the time they finally see a doctor, the tumor has grown, invaded the bladder wall, and their chances of survival are measured in years, sometimes even in months. In this video, we'll break down why blood shows up in the urine, what it might actually mean, and most importantly, how to detect and prevent bladder cancer early, before it's too late. 1. Painless blood in urine, seemingly harmless but deadly. Most of us associate blood with pain, but in the case of bladder cancer, the reality is shocking. You can have blood in your urine and feel absolutely no pain, and that's exactly why it's such a deadly trap. Urine may start to change color, pale pink like watered-down blood, or dark brown like strong tea. Some notice streaks of red, like a lipstick mark in the toilet, but then it goes away. No pain, no burning, no fever. So most people assume it's just a minor infection or heat in the body. And then they wait, they dismiss it, they don't see a doctor. Meanwhile, the tumor grows silently, invading the bladder lining day by day, becoming more aggressive and more dangerous. An elderly man from Hung Yen once said, "I noticed the pink color in my urine and thought it was just from eating beets. A month later, the blood became clearer. That's when I went to the doctor, and they told me it was stage 2 bladder cancer." Remember, blood in urine without pain, burning, or fever is a red flag. Get it checked immediately. In most cases of urinary tract infection or kidney stones, the person will feel very painful and uncomfortable. But if it's painless, the risk of cancer is even higher. 2. Confusing it with food or medication, the trap that delays diagnosis. Another reason why many seniors ignore this warning sign is because they often rationalize it through personal experience. Maybe it's from eating red beets. Maybe it's just the vitamin B12. Could be from that herbal medicine I started, and then they leave it, never follow up, never get it tested. Yes, some foods like beets, mulberries, or even medications like rifampicin, a type of antibiotic, can discolor your urine. But here's the key difference. Color changes caused by food or medicine are usually even and uniform, and they go away within a day or two after stopping the source. Whereas real blood in the urine is patchy, irregular, and might appear on and off. One day it's there, the next it's gone. Especially important, true blood in urine may be accompanied by small clots or thin red threads like strands of hair. If you're unsure, the safest step is to take a urine sample and get it tested at a trusted medical facility. It only takes 10 minutes, but could save you from months of painful treatment later on. So if you ever see discolored urine, even just once, don't casually blame it on what you ate or drank. Ask yourself, when was the last time I checked my urinary health? Am I ignoring something serious just to feel better in the moment? 3. Repeated urinary tract infections, a sign that something deeper is wrong. Many older adults often suffer from repeated urinary tract infections, burning pain, cloudy urine, frequent urination. These are signs we've come to associate with normal aging issues or weakened kidneys. But what happens when those infections keep coming back, month after month, despite treatment? That's when we must ask, is there something deeper going on inside the bladder? Something more dangerous than bacteria? Bladder cancer, especially in its early stages, can cause inflammation, bleeding, and immune disruption, making it easier for bacteria to invade. So in many cases, people are misdiagnosed with chronic infection, and their doctors keep prescribing antibiotics, all while the tumor continues to grow. One woman, age 67, shared her story online. "I had UTI symptoms for nearly 6 months. Every time I went to the clinic, they gave me antibiotics, and it went away for a week. Then it came back. Only when I started bleeding heavily and felt pelvic pressure did I get a scan. And by then, it was stage 3 bladder cancer." If you or someone you know has had 3 or more urinary infections in a year, or if urinary symptoms don't improve after treatment, it's time to go beyond the usual tests. Ask for a bladder ultrasound, a cytology test to detect cancer cells in the urine, or even a cystoscopy, a scope to look inside the bladder. Catching the tumor early, even when it's just a few millimeters, can mean the difference between full recovery and lifelong chemotherapy. 4. Smoking, the hidden fuel feeding bladder cancer. When we talk about smoking, most people immediately think it's bad for the lungs. But what's often forgotten is this: the bladder is one of the organs most severely affected by smoking. Why? Because when you inhale cigarette smoke, over 70 carcinogenic chemicals enter your bloodstream, and the body filters those toxins through the kidneys and into the bladder. So the bladder becomes a kind of chemical storage tank, exposed to cancer-causing agents every single time you pee. Studies have shown smokers are up to 4 times more likely to develop bladder cancer than non-smokers. And even people who quit smoking 10 years ago still carry a higher lifetime risk, especially if they've smoked for decades. This is particularly alarming for men over 60 who smoked in their youth and now suffer from urinary problems. They think it's just prostate issues, but in many cases, the real danger is lurking in the bladder wall. If you have a history of smoking and start seeing blood in your urine, don't delay. Get screened immediately. And even if you've quit, talk to your doctor about doing a bladder health check once a year, just like you would with your heart or liver. Your lungs might feel fine, but your bladder could be quietly crying for help. 5. Ignoring early signs when silence becomes deadly. Perhaps the most painful truth is this: most people who die from bladder cancer didn't die because the disease was untreatable, but because they waited too long. They saw the blood once or twice and brushed it off. They felt some discomfort and assumed it was just old age. They waited for it to go away on its own. By the time they finally sought medical attention, the cancer had already broken through the bladder wall, spreading to nearby organs, lymph nodes, or even the lungs. At that stage, treatment becomes much more aggressive: surgery, chemotherapy, radiation, and even then, survival drops below 50%. So don't let fear keep you from facing the truth. Don't let pride or habit stop you from going to the doctor. Because in the case of bladder cancer, early detection is everything. If caught early, while the tumor is still small and superficial, treatment is often minimally invasive. With a high success rate, you may just need a simple surgical removal and regular follow-up. But if caught late, the road becomes harder, longer, and far more painful. If you ever see blood in your urine, even just once, don't ignore it. Don't explain it away. Don't wait. Talk to your doctor. Request the right tests. Protect your future. Because sometimes, what seems like a drop of blood can be the first sign of something far more dangerous. And by acting early, you may just save your own life.